Hello and welcome to the safety demonstration of the flu vaccine, intramuscular flu vaccination. My name is Hadar Zaman and I'm a lecturer in pharmacy practice. The role of community pharmacists in particular is expanding exponentially. One of the services that community pharmacy routinely provide is the flu vaccination service. Some of you may already have had a flu vaccination delivered to you in community pharmacy. This is a key skill now newly qualified pharmacists of pharmacy schools are teaching their students. This video is designed to teach you how to safely and correctly administer an intramuscular injection. In this case, it's the flu vaccine, or something that resembles the flu vaccination. I will talk you through the several steps that are involved in the administration. So, we have several equipment that we need to make sure that we have in order to deliver the vaccination. Firstly, you will have a barrel which comes in a plastic sterile coating. This is a 10 ml syringe. You will also need sterile water which is provided in a 5 ml plastic vial. And finally, you'll need a sterile needle which comes in an outer casing. The first step is to undo the wrapping of the barrel or the injection. Once you have this, place this on the work surface and then, turning anti-clockwise the plastic water vial, undo the capping. The next step is to attach the injection or the barrel to the plastic vial, just like this. Turn this 180 degrees and you will need to draw up approximately 1 to 2 ml of water. The flu vaccination quantity or volume is roughly around 0.5 to 1 ml. In this case, just for demonstration purposes, we're drawing up 2 ml of water. Once you have 2 ml, turn it 180 degrees, place it on the surface, remove the injection and place this on the work surface, and then put the water to one side where it doesn't obstruct you in the next step. The next step you need to pay particular attention to. Firstly, you will have to undo the wrapping that the sterile needle comes in. Remove the wrapping paper. Now this needle comes in a plastic outer sheathing. Lie the needle on the work surface. So the next step is to attach the barrel to the needle. This can prove tricky in some instances. Please handle the needle very carefully in the outer casing. Attach the injection to the green end of the needle, and this you will need to ensure that it's fully locked in before you remove the outer casing. In this case, there you see the needle is now firmly locked in to the barrel. Remove the plastic sheathing and place to one side. We are now ready in a position to administer the injection. I'm going to now move on to the next step just to describe the muscle that we're going to administer in. For teaching purposes, this resembles a tricep of a patient. As you can see, we have the epidermis, which is the top layer. We have a fatty layer, which is the subcutaneous layer, and then we've got the muscle, which is in red. This injection, as discussed earlier, is an intramuscular injection. So the needle will have to penetrate and reach to the red part, which is the muscle. So pick up the needle, ensuring that your left hand or the hand that's not in use is nowhere near the needle to prevent a needle stick injury. Turn this 90 degrees, holding it with your thumb, index and middle finger. Find the center point of the tricep and then slowly inject or penetrate the needle in. This will slowly start going in, but you will feel some resistance. This point of resistance is where you're hitting the muscle, and this mimics what happens in real patients. You will have to exert slightly more pressure to go through the muscle until the needle can no longer be seen. With the hand that's not in use, hold the injection barrel. With your stronger hand, release the dose by pressing down on the plunger. Once this has been done, the dose has been released, remove your hand far away from the needle or in the injection as possible. Take out the needle gently and very slowly from the tricep, and then place it on the work surface. The plastic outer sheathing that you had for the injection, hold it from the tip end to prevent any, as mentioned earlier, any needle stick injury, and reattach to the injection firmly to ensure that the plastic outer coating doesn't fall off. Now you can remove this and dispose of this via the needles bin that will be provided in the session. This completes the safety demonstration on the use of an injection device to administer, in this case, flu vaccinations.